The nurse notes that the primary healthcare provider has prescribed sulfametazole and trimethoprim for a client. Which priority action should the nurse take before administering this medication? Which priority action? So which priority action means that this is a priority question should the nurse take before administering this medication? So there's not a whole lot of information about the patient. All we know is a medication that was prescribed, and we have to take an action before giving the medication. So ask the client about an allergy, call the pharmacy to obtain the medication, inform the client about the need to increase fluid intake, check the medication supply room to find out whether the medication needs to be obtained from the pharmacy. Wow, what an interesting scenario. So what is my priority action in this scenario? Answer number 1 says, ask the client about allergy. So what is answer number 1 has to do with? 1, the patient. 2, safety. Medication safety. What about answer number 2? Call the pharmacy to obtain the medication. This deals with the medication. Answer number 3, inform the client about the need to increase fluid intake. Wait a second. So we have a situation. The stem of the question says, what is the priority before giving the medication? Do I really have to be teaching the patient about increasing fluid intake now? Can I do that later on? Yes, so that's not my priority. Answer number 4, check the medication supply rooms. In other words, check the room. Find out about the medication. So we have answer number 1, the focus is patient and safety. Answer number 2, the medication. And answer number 4, the supply room and the medication. So what is the priority? The priority is my patient and whether the patient has an allergy to this medication or not. If you look at this question, and this is the scenario that I was telling you about, the medication is irrelevant. It could be Tylenol. It could be acetaminophen. Whatever. The focus of this question is safety. And my priority nursing action is to determine if the patient has allergies to this medication. But it could be any medication. But maybe you're reviewing this question and you don't know about sulfametazole. You don't know that this medication is given to treat bacterial infections. But in reality, to answer this question, you don't really need to know a whole lot about sulfametazole, at least in this scenario. Okay?